Hey, and welcome to your Cornerstone Live here. This is Dr. Willy and my partner, Dr. Matt, Cornerstone Chiropractic here.
Hey everybody.
Happy Friday.
Happy Friday.
That's a good thing for everybody, no matter what. So, Dr. Matt and I were talking this week. We had an interesting question posed to us, and it brought up some fun discussion. And so I'll pose the question and then share with them the question, and then you can get started on it if that works
Sure.
out good. So the question are chiropractic adjustments a Band-Aid? Yeah, reasonable question,
Yeah,
right?
reasonable
Somebody
question.
wondering and maybe not understanding. So
Yeah, and in the context that they were asking that, what was the context of that
so
question?
the question was, there was some degeneration and some arthritis already there.
Gotcha.
And the question was, is a chiropractic adjustment just a Band-Aid for arthritis or for injuries? Yeah, that's really what it was. To see, is it going to have any effect on this? Or like the thought is can you adjust arthritis away? Or can you get rid of stenosis? You know, that's kind of the thought.
Yep. So yeah, absolutely it's not a Band-Aid.
Right.
Although I have nothing against Band-Aids, they work pretty well. I've used a lot of them in my life, and a lot of them when I was a kid.
Yeah.
And they're pretty effective. But no, they're not just Band-Aids. It actually does help get in there and actually heal the tissue. Structurally, neurologically, does you a tremendous amount of good. I think you shared with me, you had a great analogy, and I have one too I'll share after you share yours. But no, it works on a much deeper level in healing. Yeah.
Yeah, for sure. The thing that came to mind for me when we were discussing it is that we go to the gym to exercise. You know, we stretch, and as you go to the gym 3 days a week or 4 days a week and doing your workouts, if you stop going to the gym and working out, right, you return back to where you were before.
Exactly.
So in essence, you could kind of look at exercise workouts as a Band-Aid for fitness,
Exactly.
you know, but they're not. I think the big concept is changing our vision or thoughts about health from one of an event to one of process.
Yes, absolutely.
Ongoing process. So, yeah.
The event versus process thing is huge. The analogy I use is very similar to yours, which is like vitamin C, right? If you're getting rickets and you're a sailor and you take vitamin C, the rickets go away. Then if you're like, oh, okay, got that fixed. If you quit taking the vitamin C, you get the rickets back.
Right.
Right.
Yep.
So,
Yep.
and then the process versus event, everybody sees. They're like, we had some patients today and their back went out, right? And they see that as happening on, Thursday, August 29th, but actually it took years to get to that point.
Right.
There was a process that led to the fact that they, bent over to pick up a pencil and couldn't straighten up.
Yeah.
It wasn't that it was a 7,000 pound pencil. It was a regular, weighted pencil. It's just that there was time, injury, and gravity had affected them to the point where their tissues weren't working the way that they should, their nervous system wasn't working the way they should, and a small thing ended up being a big stressor on their nervous system and on their overall health. And that was a process that led to there. And so it's really, really good to let you guys know that even though their back going out wasn't an event, there was a process that led to it.
Right. Yep.
And we're so deceived, really, into thinking that healing is an event too.
Yes.
Healing is a process. Yeah, we're deceived into thinking that because there's, if you watch TV, there's so many miracle pills and potions and lotions. A surgery is an event.
Yes.
But that's, oftentimes the last thing you want to have to do because. Yeah. What I tell people is when they're like, "Well, should I do this or should I do surgery?" And I say, I don't know if you're gonna need surgery or not, but before you get that surgery, you'll want to try some conservative care because you can't undo a surgery. You can't be like, you can't go and have your back flayed open and then pound things into your spine and be like 2 weeks later, I changed my mind.
Right.
Take it out. It's happened
Right.
already. So you want to try the conservative care first.
Yeah. Yeah, no, those are all exactly my thoughts. And, in this context of the question about the arthritis and the stenosis, we all know when something isn't moving correctly or it's lack of motion. The old analogy is using someone's arm is in a cast, and when they pull it out of the cast, it's super stiff. Well, individual joints in our our spine are, somewhat similar if they're misaligned, is that if there's a lack of motion there, adhesions and scar tissue and inflammation builds up, and there's stiffness. Well, the more stiffness and more tension there is, that's just at the joint level. That causes further degeneration, arthritis, and stenosis. And let alone the amazing benefits of getting pressure off your nerves.
Yes,
that
absolutely.
are there. So in this case, the idea was is if you can minimize advancing arthritis and degeneration by restoring proper mobility and blood flow and nerve circulation, why would we not want to do that?
Exactly.
It's certainly not a bandaid.
No,
it's a process.
So I have seen, I'm fortunate enough to be doing this for a lot of years, I have seen people with arthritis in certain areas of their spine. When we add stability back to that spine, that arthritis will start to resorb a bit, which is pretty tremendous. And so that takes a long time, right? What happens right away, before any of that takes place, is we get the soft tissue surrounding that injured area working better than they have maybe in the patient's life. And that's going to support that tissue better, and that happens almost instantly on the first visit. And that's definitely not a band-aid. That's a pretty tremendous thing to be able to have, is to be able to have those muscles supporting that area better. And and then over time, like you said, that we get the nervous system working better, we get the joints moving better, and the body has remodeled itself poorly. That's generally what arthritis is when it's in your spine. And if we get the stability back in there, it can remodel itself well again. The body's intelligent. It's not just going to start laying down calcium in wrong places, which is what we call osteoarthritis, just to make your life miserable. It's doing it to save your life, really. And if we can add in the stability that's missing, it'll start doing the right thing again.
Yeah. That's probably the biggest maybe eye opener for people, is to realize that their body is always trying to do the best that it can.
Absolutely.
There's reasons why it does that, and so if we can create an environment in which their body has better access to more motion, more circulation, more nerve flow, the body is going to again, give us the results that we want. There's limits to physical matter, of course, but the regenerative process of our body is spectacular, and that's what we want to harness. That's what we want to take advantage of.
And we have, I've said it a few times, but we have really better bodies than we deserve. We can treat them really poorly for 40 years. The moment we start making good choices, actually we start seeing health come back. It's pretty amazing. You can abuse yourself for a really long time and then start doing the right thing, and healing happens, even though by all means you probably feel like you don't deserve it, but it's just, even if you feel like that's the case, you do, and it will happen.
I was going to maybe just bring in a comment too about wellness adjustments, like regular adjustments, and bring that topic up for us today. Because a lot of people have utilized chiropractic care in their lifetime at some point, and a lot of people have been exposed to the get people out of pain. Chiropractic's really good about that for a variety of different things. And then they've heard those words, just call me when you're hurt. Right? And so we see a lot of those patients into our practice, and our approach is substantially different in that we don't want to allow people to get to that point where there's this reoccurring problem, because every time you have a flare-up, an issue, it leaves behind degeneration, arthritis, and further damage that can't be undone. And so with wellness adjustments, it's that process mindset again, right? And it's really not that complicated as I see it when we explain it, but why would I get adjusted when I'm feeling well? Well, we don't feel everything that's going on.
Exactly.
10% of the nervous system deals with your pain, and 90% of it deals with your function. And that's, we share that, with everybody here in our practice, but the reason that we want to check and make sure that everything is aligned and working properly from a bone and joint standpoint, but also a nerve standpoint, is the fact that you can be having things going on that are creating issues for you down the road that can be alleviated.
Exactly.
Right? Those positive steps.
Yep.
So, Any thoughts on that?
A lot actually. Like that patient that came in when their back went out, yesterday. If we could have seen stuff that they maybe didn't feel 15 years ago, right? We could see it with some of our exams, our techniques, and then also our technology. We can alleviate those problems from happening. One analogy I've heard you use before with patients, which I've borrowed, is that inflammation is like fire, and fire leaves behind ashes, right? And those ashes stay there for long enough. Ashes get wet, they turn into concrete, right? And that's the arthritis. And then the wellness adjustments there. This is not just our opinion. as chiropractors, because it's convenient for us, it's actually a fact medically that if you have a joint that's not moving, after 2 weeks, you're going to have scar tissue there. 14 days.
That's a great point.
Yep. 14 days, you're going to start building up scar tissue. And that scar tissue is, if we don't do anything with it, it's going to keep on getting worse, and it's going to turn into arthritis and immobility, and it's going to lead all the way up the chain, because there's not a segment in your spine that's not supposed to move.
Right.
They're all supposed to move, and they all move together. If you think of like a snake, or those little like toy snakes or whatever, you move, one end and then the other end moves. It's kind of how your spine is. It's all meant to work together as a unit. If one piece of that unit is not pulling its weight, it's going to put stress on the whole system.
Yeah. Yeah, those are great. That's a great analogy and a great example of that. It's simple concepts sometimes open up eyes.
Yeah.
It's like wow, okay, I see that now, or coming from a different angle. And that's really what we try to do, communicate consistently with that.
And I love and it's pretty rare, unfortunately, because chiropractic is associated with you're in pain, you feel better after you're treated, or a series of treatments. But I did have a patient recently that came in, and he zero pain, just wanted to get more out of his life. And I'm like, shook his hand, thank you. You're the people I like to see. I like to see everybody, but it's just really encouraging when somebody's like, yeah, I've heard this chiropractic can help you just live a better life. I've got zero pain, wants to get more efficient with his workouts, feel good the rest of his life, and I'm like, that is awesome.
Yeah, peak performance.
Exactly.
Looking for not just surviving but thriving.
Exactly.
Yeah.
And that's a lot of that's a lot of what pediatrics is parents recognize the benefit that they've gotten from chiropractic care, and they realize it's beyond just getting out of pain, so they're bringing their kids in. I've never treated an infant that was complaining about sciatica.
Yeah, right.
They can't talk, right? But we just want them to get as healthy and be as healthy as they possibly can throughout their life. Give them the best opportunity they can have.
Yeah, that's pretty awesome. Yeah, and everything that we do in our practice is based around the fact that your body regenerates itself, and when you take those forward steps, so any positive step forward is going to put you in a better position to regenerate and heal.
Absolutely.
And so maybe we'd chat just a little bit about our SoftWave talk coming up.
Yeah,
share
absolutely.
that.
Mm-hmm.
In September, on September 19th, we're doing our very first doctor-led, if you will, a workshop here in the office on SoftWave. And SoftWave is a technology that we brought into our office. It's got to be 3 years ago already.
Yeah, I think
Is that
a little over 2 years,
like
maybe?
that?
Yep.
Yeah. And it utilizes sound waves to stimulate your nervous system's healing ability. So your nervous system interprets these sound waves that go in and vibrate the individual cells as some form of call for stem cell and regeneration. So if you have degenerative areas, if you have pain, if you have inflammation, it's very obvious when we use a SoftWave sound head over that area to diagnose, if you will, or to not necessarily diagnose it, but to bring to the surface and make it real clear where it's trouble and where it's not. It's very obvious.
Yep. Yeah. And when we say sound waves too, I've had people, when I've explained it that way too, be like, well, we're not, hitting tuning forks and chanting all over.
That's good.
The sound wave moves at 3,500 miles an hour, and it's healthy tissue. It passes right through tissues where there's pathology, arthritis, inflammation, things like that. It'll cause some microtrauma, and that it stimulates the body to. Basically, it's like a microscope telling your body, heal right here.
Yeah. I've used the analogy on the SoftWave as kind of like when you search something in Google. We've all Googled something, right? Well, you put something in there. The first thing that pops up is the sponsored ad. Right? Somebody's paying to be at the top of the list. That's what we're doing with SoftWave. We're moving that area that we're treating to the very top of the list.
Yes,
like
absolutely.
Because we all have a certain amount of stem cells in our body that are coursing through, and if we can focus those in on a specific area to draw them there, it's going to speed up your body's ability to regenerate.
I love that analogy. Yeah, that's very true.
That's what we want to do.
Yeah, and so this talk is for everyone. If you're currently a SoftWave patient, you can certainly attend and learn more about what's happening when we're doing the treatment on you. If you're currently a SoftWave patient and you bring a friend with you that's not a patient here, we got a nice little bonus for you, 300 free waves, which is going to be great.
Yeah, it's a free session for you.
Absolutely.
At our expense,
Yep. And if you're a patient of ours and you want to bring a friend, you actually get a free discovery session, which is a great value as well.
Yep. So our discovery session in the office is just that. It's to discover whether or not you're a candidate. Because we've had people that we've done our discovery session on, and we map out the area with the sound head to looking for these areas of pathology and degeneration, and it's not indicated for them.
Yep.
And so if it's not indicated or it's not going to be beneficial to you, it makes it clear we don't want to be doing anything with it then. So, however, if it is, then we know how extensive it is, how many waves we need, you know, the numbers of sessions generally you're going to respond to. And so the discovery session is really informative.
It is, and the thing I like about it too is, you know, the discovery session is a flat rate, and we use several more dollars worth of waves on your area than you're paying for. Right. But what's also happening is, one, we're discovering if you're a candidate, and two, we're actually, if you are a candidate, we're mapping out the areas. Because, like I said before, the wave will pass harmlessly through healthy tissue. Yep. Right. But once you're paying for the waves, we want to be putting them in the areas where they need to go. So the technician that's running it will be making notes of where the areas are, so that once you're paying for them, they're just going to where you need them.
Yeah, yeah. And it's really a focused therapy, you know. And and a lot, you know, people have knee issues, knee pain, plantar fasciitis. I've treated that successfully for myself and others in our practice. Elbow pain, golfer's elbow, tennis elbow. There's just a variety of. It's really nice that we can focus the care on that specific spot, and yet it's a natural healing thing that's drawing from the inside
out.
It's not something we inject or you know, that way. It's very much what comes from the inside out.
Absolutely.
Yeah. So on that night, we'll have our SoftWave machine out, and we'll actually be able to demonstrate for you. If you have a wrist or an elbow or a knee that you'd like to have us, put a few waves through, so that you can actually feel this thing. Without coming in for discovery, you can actually come to that session and understand the process, understand what we've done. You'll see some testimonials and experiences of our other patients who've had great success with this. And we'll be able to do that, show that to you. And then if it's something that you want to do, of course, we'll make that available for you that night as well. But I'm pretty excited about sharing that.
Me too.
It's like hidden. I mean, we've had it for really 2-3 years. Yep. And I've personally benefited a lot. I know my family has. I mean, man. So it'll be fun for us to share that in that open format.
Absolutely. And then, like I said too, we'll be diving into kind of what it's doing on a cellular level, some of the science behind it.
Right.
So it's really exciting to be able to share that information, because it's really, even if you are a SoftWave patient, it's hard to get all that information in your visits, because you're focused on a lot of other things. So this will just be a little deeper dive into what's happening. Yep. So you just got back from a really cool conference. You want to tell us a little bit about that? We talked about it in our last slide, but you want to tell us a little bit about how it went and
Absolutely.
What you learned?
Yeah, it was part of our preparation in getting ready for bringing on hyperbaric oxygen therapy, and we did share that with you. This conference was out in New York, New Jersey, and it's a 40-hour class. I haven't been to a conference. It was
That's intense.
Yeah, I mean, I've told people this already, but we were doing physics equations and gas laws and math, and all sorts of biology and Krebs cycle and all this different stuff about mitochondrial energy, and so we've got a lot to share with you guys. But it was what was mind-blowing about it was the extent at which the different areas of the body that it acts on, and the different mechanisms of action, which we won't go into all today. But people say, well, how does it help this and how does it help that? And there's a clear method of action that the body benefits from increased oxygen. And really today, maybe one of the take-homes is that I'll just share this, is that the only way to get increased oxygenation through your whole system is in a pressurized environment. We have red blood cells in our system that carry around oxygen, and we breathe it in through the air, and it goes into our lungs, of course. And our red blood cells, generally, if you put a little pulse ox on, 98% most of the time to 100 potentially, So if we drop a few percent, people start noticing energy issues. So if we're 2% from being fully oxygenated, 100%, that's not a lot, right? You can't increase a lot. But what happens in a chamber is that when you're in a pressurized environment, which is very comfortable, it's kind of like, we call it you dive, kind of like diving in the ocean, because there is some increased pressure. You need to equalize your ears, and there's a process with that. There's never any pain when you're in a chamber. We don't do any sessions if there's any discomfort. So the idea is it comfortable? Yeah, it's 100% comfortable, or we don't do it. Yeah. Which is really, really interesting. But equalizing your ears as you take this dive, but the pressure increases in the inside of that chamber is greater on the outside of your body than on the inside. So with that oxygen being condensed, that allows you to breathe in that oxygen, And because there's greater pressure in there, that oxygen it will fully oxygenate your red blood cells very quickly. This is only 2%, it's very fast. But what it does is it starts to go into the liquid in your body. Okay. So the soft tissues. So your plasma starts to fill up with that oxygen first. Then, of course, the water and soft tissues all throughout your spinal system, your body, you breathe it in, it starts to move into the soft tissues because the laws of gas, from a higher gradient to a lower, that will pass into that liquid, okay? So your body starts to become hyper-oxygenated, super-oxygenated, if you will, in all these tissues that you couldn't drive oxygen in there any other way. Wow. It's just impossible, right? And so we'll elaborate further, but what I want to say is that when you come out of that dive, okay, it's very easy decompression as you come out of that, and you come to the surface, you have to think about what happens to that oxygen that's been pressed into those tissues, that liquid. And what happens is that pressure comes off, and those oxygen molecules travel. They measure this, and they travel 4 to 5 times further into your body than where they currently are. So it's kind of like when you open up a can of pop of compressed air.
Okay.
You know, it comes out like that. Pressure comes out. Well, what's so cool about it is that oxygen is in your body, and as you come up from depth, if you will, that oxygen just releases through your tissues, right? It doesn't come out of your body. Ultimately it will, but it releases into your tissues. So what you're getting oxygen into areas where you don't even necessarily have blood flow. Oh. All right. Okay. So I mean, we've got people that have areas of their brain or areas of their body or areas of their joints that have had degeneration. We've talked about arthritis today. Have lack of circulation, neuropathy, all these things where oxygen is not getting to the tissues. All of a sudden, that oxygen can just go into those tissues. So anyway, super exciting. Got a little sciencey there, but I mean, when you hear these kind of concepts, you go, this is incredible.
Want to be able to share them.
Yeah. So that was a fantastic conference, very in-depth about how we're going to implement this. So Dr. Matt and I are taking a lot of great steps on that. We've identified the equipment, the chambers that we're going to be purchasing and bringing onto the practice here. So we're looking at somewhere in October or November of this year to actually begin doing sessions and offering those sessions for our patients. I know that, you know, we're going to be first in line, you know, getting this thing operational because of the exciting benefits. I'd like to have one at home.
But, maybe order a couple extra.
So we'll be super thrilled to have those coming up here in October and November. So yeah, great conference. It's going to be great information. So much more to come that we're going to share about that. So,
that's awesome. I think we should probably wrap it up and give these. I know half of Minot's glued to their computer right now.
Yes, right. Go ahead and take a breath. Take a breath.
Enjoy your lunch.
No, but thanks for watching now, or if you clicked on this link to take a peek at it, great. Appreciate your attention, as always. If you like it, share it with somebody else. If you have any questions for us, please throw them our way. We'd love to answer those for you too. Otherwise, all the best, and we're going to keep doing what we do and, you know, bringing you the very best of health here in Minot.
Absolutely. Happy Labor Day. Thank you, guys.
Cheers.